My patient, Simone Biles, is a 24-year-old Olympic gymnast who has suffered a gastrocnemius tear in her left calf. She has world finals in a few weeks, so she would like to get back to running, flipping, and jumping again as soon as possible. For her pre-exercise screening, we are going to get her height, weight, her blood pressure. We're going to do a joint mobility assessment as well as a muscle strength assessment. Her main goals in order to get back to doing gymnastics are sprinting, flipping, high jumping, endurance, and balance, most importantly. The Thompson test is how we will rule out if her injury is an Achilles rupture or if it's just a gastroc strain. This is a non-invasive, quick test that will help us determine if Simone needs surgical repair of her Achilles or not. So next, we're going to do the Thompson test, and this will determine if the patient has an Achilles rupture or if we're dealing with just a gastroc strain. So this will be one of the earlier tests that we'll do. So I'm gonna have you lay on the table, face down, and have your feet off the table a little bit. Good. Yeah, that's good. So I'm just gonna roll up his pants. So what I'm gonna do is I'm gonna squeeze his calf muscle, and his foot is going to move slightly if he does not have an Achilles rupture. Okay, ready? Just relax your foot so you can see his toe moving slightly as I'm squeezing his calf. Good, so he does not have an Achilles rupture, and we are determining it as a gastroc strain. The Pro Agility test will measure Simone's ability to rapidly change direction, which will help us determine if she has any deficits in her calf power and control. This is important, especially for gymnasts, because they often rely on the intrinsic foot muscles and calf muscles in their tumbling passes or vaults, etc. Simone will be doing the Pro Agility test. So what you're going to do is run from this middle cone to the second cone, tackle, run past the middle cone to the third cone, tap it, and then run through the second cone as fast as you can. And realistically, these cones would be each 5 meters apart. Okay, go ahead. This is the vertical jump test with the Tendo unit. This is going to measure the anaerobic power of her lower body. She needs this for jumps in all of her routines, but specifically her floor routine. So to set up the Tendo unit, you hold the on button. Okay. And it's already on peak power, which is what we're measuring. And then I'm gonna hit reset twice, and then it's ready. And she has the band around her waist, and it's connected to the Tendo unit. And then she's just gonna jump as high as she can and hit the top. And you can go. Nice. It's not really showing up on the video, but it says 100 and it shows 1 rep, and then this is her peak power. It says 3661. She jumped 14 inches. We'll be doing the STAR test, which will measure her balance and how far she can extend her leg while keeping her center of gravity over her base of support. We will be doing this test for her gastroc injury because this muscle is essential for plantar flexion, which is important for controlling single leg stance and balance. For this test, we've placed cones in a circle 45 degrees apart, and she's going to stand on one leg with her hands on her hips and reach as far as she can in each direction of each cone in a circle until she reaches the front again without putting her foot down or falling. Okay, you can tap like that, but you just can't put your foot down in the middle. Okay, go ahead.
Do I turn or not? I stay right here.
No.
Ooh. Ooh.
Nice.
Wait, wait.
There you go.
Oh shit.
Really, you don't have to go super far if you don't want
Yee.
to. I see. There you go.
Ooh. I was gonna eat it. But...
Can you get this one?
Do I have to go back?
Yeah. You can do either way. Yeah, that's good.
Okay.
Great. Good job. So then I would measure the distance to each marble, and that would be her score. We will be doing the balance error scoring system test, which will test her balance, specifically the tandem stance for beam. Gastric strains also affect knee and ankle stability, which will also be assessed in this test. This test will also help us identify if Simone is overcompensating with other muscles, which can potentially lead to more injury. Okay, we're going to be doing the balance error scoring system test. So what you're going to do is you're going to put your hands on your hips. Okay, put your hands on your hips. You're going to stand hip distance apart, so your feet can be a little bit apart. Realistically, we would be doing
on the same surface.
Yeah, and then back up. Realistically, we would be doing this on an Airex pad, which is like a thick foam pad that's an uneven surface. So that would make this test a bit harder, but we don't have that here. So we're gonna be doing it on the floor. But you're gonna have your hands on your hips, stand hip distance apart, and you're gonna close your eyes and try not to fall over or wobble or take your hands off your hips for 20 seconds and keeping your eyes closed. Okay, does that make sense?
I got you.
All right. Okay, ready, go. And stop. Good. He had 0 errors because he did not take his hands off his hips or wobble or fall over in any way. So now you're gonna do one single leg. So you're gonna have one of your legs up and bent, so try not to have it too close to the ground. And hands on your hips still, and try not to let this leg come out or fall backwards or take your hands off your hips at any point during the 20 seconds.
Does it matter which leg?
We're gonna do both legs, so you can pick which one you start with. And your eyes are gonna be closed.
Okay.
Okay, ready, set, go. Really cool. And stop. You can stop. So I would say he had 2 errors just from the leg coming out like that. Okay, now we're gonna do the other side. Ready? Okay. Okay, ready? 3, 2, 1, go. And stop. I would say he had 3 errors that time. Just in the beginning, putting his foot down and then wobbling with his foot a bit. Okay, so now we're gonna do tandem stance. So you're gonna have your hands on your hips again, and you're gonna have one foot in front of the other, heel to toe. Okay, they have to be touching. Does that make sense?
So like this?
Yes,
Touching?
yeah.
Alright.
And then hands on your hips. We're gonna do both sides. So,
Eyes closed.
yes.
Okay. I can pick which one first.
Mm-hmm. Okay, one foot in front, and then hands on your hips. Okay, ready? 3, 2, 1, go. And stop. You can stop. Good, you had 0 errors, no wobbling or falling over. All right, other side. Yep, make sure heel to toe, hands on your hips. Good, and then you're gonna close your eyes in 3, 2, 1, go. And open. You can open.
Make sure.
Good job. And that was the best test.
Balance.
Yep, we did tandem stance, single leg balance on each side, and 2 leg balance. Good job. So now I'm going to explain her exercise prescription using the FIT principle, which is frequency, intensity, time, and type. So she will be doing the whole program 4 times per week, and the other 3 days she will be doing either just the mobility portions of it or just the stability and balance portions of it, and then the last day she will have a rest day just to give some variety within the week. And we'll be doing 4 days just because she is trying to get back to play and she has finals in a few weeks, so we want to get her gastroc nice and strong and ready for her competition. For her exercise prescription, one of the exercises we're going to do is 4-way ankle, 2 sets of 10. This will target and strengthen the supporting muscles around the ankle and calf. A strained gastroc can throw off stability, which is important for events like beam. 2 sets of 10 each leg is a good amount to get the calf warm and ready for other exercises in the prescription. Next, we will be doing seated calf raises, 3 sets of 15. Seated calf raises will target the soleus because the leg is in a bent position, and the soleus is a deeper calf muscle, so working on this muscle will help strengthen it and take the load off of the gastroc by making the other muscles around it stronger. This is really important to decrease the load because it will provide stability during landing, which is really important in all aspects of gymnastics. 3 sets of 15 is a good amount and a larger amount due to being seated and not having as much load on the legs and the calves from being in that seated position. Next, we will be doing heel and toe taps on an AirX pad. We will do 4 sets of 8 each leg. So we'll be standing on one leg, tap the heel in front, and then tap the toe in the back. This is a very good exercise for training stability while on an unstable surface, which would be great for gymnasts on a beam that is very skinny. This will challenge single leg balance as well as the calf muscle eccentrically and concentrically due to dorsiflexion and plantar flexion. 4 sets of 8 each leg is a amount that will help train the muscular endurance of these muscles. The next exercise is single leg hop in a box, 4 sets of 10 each leg. So the gymnast will be standing on one leg, hop to the front, side, back, side, and then we'll switch legs with the set amount of sets and reps. This exercise is crucial for gymnasts' rebounds and takeoffs. This exercise will also help train the landing technique, which gymnasts obviously need for every aspect of their sport. 4 sets of 10 each leg is another way to help increase the calf muscle endurance and all the foot muscles endurance as well. Next, we'll be doing heel and toe walks, 2 sets of 15. Gymnasts really rely on toe point, push-off strength, and balance in their routines, and this is specifically supported by heel and toe walks. These exercises also stimulate how the foot and calf work during routines, specifically beam and floor routine. 2 sets of 15 is a functional amount that won't cause too much fatigue. We will also be doing toe marble pickups, 2 sets of 10 each foot. This exercise will help strengthen the intrinsic foot muscles, which are like the little tiny deep foot muscles that help with balance and stability, which are 2 key components of gymnastics, specifically on beam when gymnasts are walking on their toes, spinning on their toes, or flipping on the beam or flipping off the beam. The first set will help to get the muscles warmed up, and then the second set of 10 will kind of encourage muscular strength and muscular endurance. Next, we will be doing jump to stick, 3 sets of 6. The gastroc acts eccentrically when landing, so this drill practices using the whole foot to help absorb the body into the ground safely. This is specifically important for gymnasts who must stick almost every landing that they do. 3 sets of 6 is a good amount that won't wear out the athlete, but will also allow for soft landing practice. So we're also going to do standing calf raises, 2 sets of 20. Since the gastroc is most active when the knee is straight, this is a good way to target and strengthen this muscle. 2 sets of 20 is a good amount to start with that will allow for progressive overload by maybe later going to single leg or adding weight. A little bit later in the exercises, maybe one of the last exercises, we are going to do the slant board for 2 sets of 45 seconds. This is a stretch that will help reduce the risk of injury in the future. A tighter gastroc can create risk for more injuries. 2 sets of 45 seconds each leg is a good amount to allow the calf to relax and adapt to the stretch. Another exercise that we will do later in the program, possibly the last thing we will do, is roll out the calf for at least 2 minutes each leg. After a strain, the muscle can become kind of tight and guarded, and rolling out the calf can reduce the tightness and tension as well as improve circulation and blood flow to that area.